growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of the Lionhearted, where Dr. DrRasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi everyone, I'm Dr. DrRasner. Welcome to the Lionhearted Dentist. A couple housekeeping items I want to go over. One, I'd love you to email me on your thoughts or any ideas you'd like to expound on these podcasts. And that's an easy one. You can email me at my name, DrRasner@AOL.com. Also, I want to encourage those of you that have any interest in oral surgery, implants, taking teeth out atraumatically, growing bone. I'm not telling you this because we don't have a very healthy roster for our courses. We do. I've never had a course in my office in Vineland that wasn't sold out ahead of time. And that's why I'm telling you, the first courses this year, if you go to the RasnerInstitute.com, are in March. And even though I'm talking to you in December, there's only a couple spots left in each course. We give them in March and we give them in the fall. And they are absolutely instant impact on your skill set. If you can tell from these podcasts, that I hope you can, that I'm a genuine guy. I am telling you I designed these courses specifically with the amount of patience I give you and the information I get from you ahead of time to create a learning atmosphere that enables you to go right back and exercise what you learned. And that's not always the case with hands-on courses. And if you don't know what I'm talking about, we're talking about, I have a very fortunate agreement with the state of New Jersey where you're allowed to come to my office without a license in New Jersey and work live on patients, which is unbelievably helpful for those courses involved in surgical dentistry. And there's two different sets of courses, as I indicated. There's taking teeth out atraumatically and bone grafting, all in anticipation that you guys will hopefully follow my lead and then learn surgical implant dentistry as well. So that's in March and then the fall of 2021. So, important stuff. Last week when I spoke to you, I was marveling, to be honest with you, at the strong quarter that I finished with in 2020, despite the pandemic. Just unbelievable success. And I've talked to you all through the pandemic, and I told you at times that it's slower than it used to be, to the point of telling you that I enjoyed it being slower. And that is still true. But what isn't accurate is that our numbers are down, because they're not. They're up. They're at record-setting levels, which is even all the better. I mean, listen, sometimes I, your moderator, lose focus of what I do these for. This is why you're listening to me right now. I do these because I really firmly believe that you can have what I have. And that's a big statement to make. And what I mean when I say that to you is that you don't have to have been in the top 1, top 10, top half of your dental class even. You can even be what you consider to be an average clinician, and you can change that through the vehicle that I changed my skill set over the years of CE. Okay? And if you add to that some very special practice cornerstones of business and of running an organization that I have followed over my lifetime, they are unbreakable. It's just unbelievable to me. I mean, I went through 4 recessions from 1980 through my career. The only recession that got to me, and I always tell you the truth, the only one that affected my numbers was the Great Recession of 2008. And That lasted about 3 years. It was the only time in my career that my numbers went south out of 40 years. So 37 of the 40, the numbers always went up. The productivity went up, the amount of time I had to work went down, and the net profit went up. And not only that, but I've had a longevity of a team with me that's averaged over 20 years. And I'm certainly, if I'm coming off as I'm bragging about this, then I'm coming off wrong. What I'm trying to say to you is I find it remarkable as well. And I also find it replicable. Like, there's no way, it's lucky. First of all, when you just deal with the staff situation that I just alluded to, I'm in a very challenged area that a lot of people don't want to live in. So when I put an ad in, for example, for a dental assistant or a dental hygienist, I don't get 5 or 6 or 7 candidates. I got to really weed through and sometimes take somebody and hope I can mold them into a special dental health skill provider. And sometimes I'm wrong. So it's not like anything that has to do with luck. And it's not like I haven't overcome a number of obstacles along the way like many of you. So when I discover in the year of a pandemic that our numbers have been brilliant, and when it's happening, you better believe when I go through a day or a week, I'm thinking about this podcast. And something great happens. You know, I have a tremendously successful week, you know, based on, like sometimes I have 2 or 3 new patients in a whole given week. But 2 of those patients may be treatment plans of significance that account for a really productive, successful week. And I'm getting to do procedures, which I want you to feel and live, that are challenging. I mean, if I had to do crown and bridge all day, I just can't imagine that being sustaining for me as an individual. I'm not saying it has to be surgical dentistry, because I say that to you because you know that I've encouraged you to incorporate that in your skill set. And I do. For me, unless you're just turned off, and some of you are, by blood and all that, it just goes with the whole paradigm I've been trying to push on you over the years. That paradigm is get a sedation license from your state or from your country or your province. Get an oral sedation license. And then don't use what you hear out there the most, or if you want to use that protocol of oral sedation, it's called the docs. And I'm not saying it's even bad. It's probably fine. But try mine. I just tell you, it's so remarkably predictable for 25 years now that I just can't imagine there's anything better. And I'll send that to you if you write to me. If this is one of your first times listening to me, you know, you can be assured that I'll get back to you and get that sedation protocol from A to Z out to you. But I recommended get a sedation license. I recommended learn how to take teeth out. Why? Well, because when people come to you, which they will find you with sedation, because you are going to be masterful with sedation, because it has nothing that much to do with you other than you being diligent and thorough about the health of your patient, the ASA1 or the ASA2. Should you not give them this or that? Should you not work on them in a private practice situation? Should they be in an oral surgery or in a hospital environment? I mean, being a good doctor is always at the base of what I preach. That said, if you did get a sedation license and you did what I told you to market that you have sedation and offer that, you are going to feel it. I don't care where you are in the world, you're going to feel it. So it just goes with that skill set to be able to take their teeth out. And then if you're going to take their teeth out, it's certainly, to me, is standard of care, whether you're placing implants or not, to develop that site of extraction, site development, also known as bone grafting. And that's a huge area of what we do these days. And then certainly the final leg to that would be surgical implant dentistry. And if you haven't heard me say it before, I'll say it tonight. When I talk to you about a career of doing surgical implant dentistry, you can have a really fulfilling, impactful on your practice career just doing easy implants. People that have abundant bone. There really is such a thing. There is. There is challenging, difficult sinus lifts, ramus grafts, horizontal, vertical augmentations preceding your implants. That's not easy. But there are patients, abundant patients that you see each year that have a lot of bone, and they're ASA1 patients, and they're healthy, and they don't have any contraindications. They're not diabetics. They don't smoke. And if you had that skill set under your wing, oh my goodness, it makes a difference, my friend. That's what the basis of the Lionhearted Dentist is about. And I have said this also, that even if you are turned off to the surgical site, I would absolutely get my sedation permit and focus on endo or focus on extensive crown and bridge. Okay, let me go back to, I told you that I traced my numbers back, why we did so well in the final quarter of 2020, to 3 parameters of many that I've shared with you over the last 2 years on this Lionhearted broadcast. And that was a killer, out of this world case presentation. 2, having a practice with a giant nucleus, meaning you don't turn off patients. That's really what I'm saying. That even patients that don't accept your treatment plans continue to come to you. And if they could afford to do the work, they'd want you to do it. And then 3rd is being a relentless leader. And they're the things I want to start breaking down in this particular podcast. But let me say this. I'm going to start with the practice as a giant nucleus. And I want to tell you some things that you wouldn't expect maybe that I would say that account for that. I want you to really hear me on this. So first of all, don't forget that when I talk to you, I talk about case presentation, you've always heard me refer to a complete exam, right? I got that 30 some years ago from Pete Dawson, one of the finer dentists our industry ever had known. And he was a disciple of L.D. Pankey and people that are pure, really good clinicians, really were wonderful representatives of what you and I do every day. And so you need to know that even though a patient may not accept my recommendations, which is quite often, my approach is complete dentistry. I'm looking at 5 arenas of their mouth. And if you go back to my very early podcast, there's multiple weeks I dedicated, and some of them back then were 45 minutes long, to every component of the case presentation mindset that you need to have. And you really need to look at this and see if that's one of the things that maybe you're not doing well enough. Do you understand that everybody that comes in my practice has a treatment plan? That they didn't come in and say, Dr. Rasner, I'm here for a treatment plan. They came in with a chief complaint, a broken tooth, pain, bleeding gums. I had all that this week. If you go back to those podcasts, you would see how I arrived through the language I use at talking to these patients about why I look at 5 areas. And you've heard me say this ad nauseum to you, no matter what they came in for. And the patient gets it. Do you understand that I've never one time experienced a patient when I'm going through that type of exam saying to me, why are you doing this? I only want you to fix a chipped tooth. Okay? So that's a big subject for me to tackle. But what I'm getting at right now is, well, how do you get the giant nucleus? And you get the giant nucleus by being a likable dentist, being a likable office. Now, some of that has nothing to do with you and your day-to-day activities. It's having a front desk, that reception area that you have embraced for them what you want, a welcoming, making people feel value type of atmosphere. I mean, that's an easy thing to develop, but not if you don't spend time focusing on it. Have you ever had a meeting dedicated to that? Remember I talked about the importance of meetings a couple podcasts ago? I mean, that's actually a fun one to have. But what are you doing right now? That's what you have to say. What are you doing in your practices as a new patient? Do we use first and last names? Do we greet people? Do we smile? Do we have positive people at our front desk that are capable of pulling that off? Do we use certain words? Certainly, right away. I can consider it done. Is that too fluffy for you? You don't want to do that? That sounds like, I don't know. Why wouldn't you want to be that kind of practice? When you walk in my dental practice, I think it's the immediate reaction is feels like a spa. It doesn't feel like you're in a Ritz-Carlton hotel. There's no marble and stuff like that, but it's a cool, calming vibe. And that does not cost an arm and a leg. It costs a little bit of money. But more importantly, I should say, I do think the lighting and colors are important. But more importantly is what goes down with the people that they see first. And of course, that goes all the way back to the initial. You certainly better believe it goes back to the very first phone call. I'm telling you this because these people are experiencing something. Think about it. I mean, I don't think you get it. In the area that I practice in, they're not used to this. And when I say they're not used to it, they're being treated as if they are a very valuable person, which they are. We want them in our dental family. Whether they go through with my recommendations or not will be another story. So they go through this process, and I don't get a whole lot of new patients, to be quite honest with you. I mean, it's been a long time since I can't give you a number, but I don't know, I think 8 a week. Nah, it's too high. I think 6 over 4 days is the most I usually get. Now, these patients have been screened. And if you don't know what I mean, go back to one of my early podcasts, because I'll never get through to the meat of this if I keep stopping. But they've been screened. In other words, they know they're going to get a full set of x-rays. They know they're going to get a complete exam. They've been told this in a very proactive way over the phone to give them the chance to opt out. Why would I do that? Because I've experienced that moment when my hygienist comes back to me and says they won't let me take any x-rays, just the one on the tooth. Or they don't want me to really look at the rest of their mouth. What are you kidding me? So, no, I have operations, policies, whatever you want to call them, in place, so that doesn't happen to me. Ever. That's what I mean by a screen. So they're screened, they come in, and it's a very pleasant experience. And when I have my moment with them, and I'll break that down even though I've done it many times with you, I'm going to break it down in a future podcast again. And I told you at the last podcast, I'm always developing myself when I'm dealing with these people. What I'm looking to do, more than anything, is be believable. I mean it. I have a patient in my chair. After the x-rays are done, I walk into the room and examine, and everything's been charted. They haven't been probed. I don't like them to be probed until they're numbed. That's a conversation for another time. I think it's a tremendous turnoff to patients. They may be spot probed or carefully probed to check for BUPs, bleeding upon probing. I mean, but if we see bone loss, we're not going to start jabbing the patient. Give me a break. That's not what we're doing. Remember, a lot of these patients that I'm alluding to come with fear. So the last thing you want to do is start digging in with an explorer or a periodontal probe. And so I go through my 5 arena of exams, And I have this significant other in a chair in the room. And I go through my thing. And I got to tell you, I am not shy about looking at a patient and saying, listen, there's no one set script I always use. I say what I say based on what's happening in the evolution of this interview that's going on between me and this patient. And there's certain things that'll happen. So for example, this happened this week. This is a good example. If I notice this patient has never had any sophisticated dentistry, in other words, no root canals, no crowns, I see multiple missing teeth. And now I'm looking at a patient that's 44 years old that needs 3 root canals. They are totally restorable. He's got good bone. He's already missing 3 teeth. He doesn't have 7 other cavities. He's got 2. But 3 of his teeth definitely need root canal and full coverage. And that still doesn't address all the areas. It doesn't address the areas of missing teeth, which is implants. And this is a good thing for you and I to discuss right now. And so in that one scenario that I'm using as an example, what comes to my mind is this. I find it necessary to say, so listen, let me back up for a minute. I'd literally say that. Now, mind you, he's sitting in my chair. And by the way, we made a mistake with this patient. This was his second time in because we like to make sure they can stay for an hour and a half. And somebody dropped the ball and he had to leave within 45 minutes. And I couldn't even begin this process last time he was into practice. So this was a follow-up, and all we did the first time is meet and greet, shared my philosophy of care, which I do with every patient. It's in my early podcast, where I walk in and I say, listen, let me tell you where you're at. Let me tell you where you're sitting today. Because not all dental offices are alike, and I think you're going to find this one different, and I think you're going to find it good. I think you're going to like what I'm going to say to you. And I had that conversation with him. And I went into how passionate I am about dentistry and how my goal is to provide and create a relationship between that patient and my office where the outcome is you have a very, very healthy mouth. And you trust us. And it's a place that you don't fear coming to or dread coming to. And that comes across very, very authentically to them because it's true. That is why we exist. And so this guy is in my chair this time. It's a month later. And I'm thinking to myself, this is going to be difficult because he's never had anything done. All he's ever done is had teeth removed. So I thought I felt the need to address that. So I did. I said, listen, you're 44 years old. And I can tell by looking in your mouth that you really have never had anything significantly done or sophisticated. What you did, for whatever reasons, maybe you were too young, maybe you weren't a decision maker at the time, but when you had trouble, your teeth were removed. And now you're sitting here at 44, and what do I see? Well, I see a guy with healthy bone, which I'm all over. And by the way, he needed quadrant scaling root planing. That is always my number one go-to. That's part of my wrap, where I tell them the 5 areas I'm going to look at and why. And the first area is the health of their soft tissue and periodontium. Because what's the point of fixing up your other teeth if we don't have that under control? But he did have excellent bone. And these teeth were, I think they were first molars, all 3 of them. 2 first molars and a premolar. And I said, look, I know that means you've never spent any money or time. You've never invested it in your mouth. And that is what I'm going to encourage you to do. This isn't the office where, oh, it needs something, we're just going to pull it. I would have a hard time participating in that decision with your mouth. And what I meant by that, I meant that. And so here's the end of the story. Money was a problem. You know, I think money would have been a problem, I think, for anything I did with this gentleman. I assure you, even though what he did is he reappointed for the scaling root planings, and he's going to, as he says, pay as he goes. My experience has been, no matter how lovely and well-intended a patient may be, that generally leads to broken appointments. It defies everything I believe in. Not because I'm greedy and I want to get their money up front, because I want them to make a commitment. And when their commitment is, I'll pay as I go, it's not a commitment. So there's a very high probability that this gentleman at this stage won't follow through with treatment. But I assure you, he's not out there bad-mouthing me. I didn't go over the fees with him. I wasn't in the room at the time, obviously, for that. I'm sure they might have been shocking to him. And I'm equally sure that he left with a good taste in his mouth. Because I said, look, I'm not here to sell you anything. You're 44, do you have kids? This is how I talk. His wife was right next to him. And they had a couple kids. I said, I'm sure it's very expensive. I'm sure you have a lot on your plate besides coming to me. But I'm an office that really does try to educate and push my patients for optimal health. Because, yeah, it's a quick fix to get rid of 3 more teeth on you now. And that's, one visit thing. And then you're just going to go down that road. So what's the next step? A partial denture a couple years from now? And then maybe a full denture? That's not the road I want my patients to take. Maybe he'll leave me. But he won't think I tried to shove dentistry down his mouth or try to get him to take out a loan he couldn't afford. I was educating him. I don't know which of the famous doctors said it. I think it was L.D. Pankey. Part of a complete dentist is educating their patients. And the Lionhearted dentist believes in that. I didn't realize this was going to go so long. I want to tell you some other things that I don't think you've ever heard me say. When you're doing every exam the way I'm presenting this to you, like, trust me, sometimes I look at these patients and I can't help it. I'm thinking, I look at their x-rays, I see they never had any work done. I'm thinking, what am I doing? Is this really have any prayer of happening? How did he even get through the screen? That's what I'm thinking sometimes. But it does. And I end up having this very vibrant, busy schedules. And it allows me and affords me to facilitate the whole thing by doing a lot of gratuitous things for my patients. That is a weekly, if not daily, part of my practice. And what do I mean by that? I want you to hear me. I have patients that get in bad situations that were once invested very much in their mouth, and things change in their lives. I mean, your practice, is it not like a small community? It's like a little city that you're the mayor of. You're the dentist and the mayor of your little city. And sometimes in the city, people have ups and downs in their lives, right? And I'm going to tell you, in the last couple of weeks, these are things I've done. I have re-cemented a crown, post and core. Have you ever seen that one before? Of course. Crowns out, history of root canal, post and core, broken at or below the gum. This particular patient was about 38 and had just invested for the first time in his mouth. Probably spent about $5,000 or $6,000. And I didn't see this coming. I didn't see this happening. Neither did he. And shortly after we finished, it was number 5, premolar. He comes back in on a different day and says, I think this crown is loose. And sure enough, it's what I told you. And I told him, I said, you know what? You just had a lot of work done. It was a kind of situation where I said, I'm going to recommend that we re-cement this. It's not going to last. I don't know if it's going to last a month, but if I just met you today and it was the only thing we were going to have to do, it's not what I would do. He had an implant by me, by the way, to replace a different tooth. His occlusion was reasonably balanced. This was just a tooth that was in trouble. And I re-cemented it and told him, let's try to get a couple years out of it. And I didn't charge him. I did not charge him. In the past 3 weeks, I had an older patient, lose a lower central incisor, offered a couple possible treatment plans. It was clear that this wasn't going anywhere. Extracted the tooth, used it, and bonded that tooth I extracted to their adjacent teeth. Not telling you this so that you'll think that I think I'm special or a hero. I did not charge that patient for that service. When I have something that fails that I did, even if it's on the border of it's clearly not my fault. In other words, they skipped a couple hygiene visits. I could easily make the argument. We always honor our work. Case in point, I have a lifetime patient that recently we referred to a very good endodontist. He did endo on number 19 or 18, I don't remember the tooth. We crowned the tooth. The tooth became then symptomatic. He had the endo, I believe, retreated. And my endodontist is not shy about recharging. And the symptoms, long story short is I'm taking the tooth out, grafting it, placing an implant at no additional fee. Now, I think I'm a pretty good clinical dentist. I don't have too many stories like that one. But I promise you this, we are fair to a fault. I'll say it again. Our policy is we are fair and accountable to a fault. I'm probably wrong sometimes. I probably shouldn't have to do as much as I do. But I don't regret it. We stand behind our work. And if there's a benefit of the doubt, the patient gets the benefit of the doubt. And that's part of trust. That is part of a giant nucleus. You better believe I lost track how many crowns we resubmit a year that probably need a new crown. A little decay. Patient is not in a position to address it right now. It is part of the circle of trust. I think I borrowed that from a movie. And is part of having a giant nucleus. Trust is everything. I hope this is resonating somehow. I'm trying to give you the picture, which is kind of hard to do. By the way, I mentioned several podcasts ago, maybe in 2021 or 2022 even, the end of the next year or the following year, I'd love to have a live, I'd make it very affordable, just so I can meet the thousands of you that downloads these podcasts each month. I think that would be awesome. If you have any interest in that, hit me with an email. Last time I said it, I think I got one email. And I think that was from one of my cousins. She wanted to come. I would like you to come. I think that would be a blast. A lot of this stuff is meant to be longer than a 30-minute podcast. But I hope it's coming across. I hope you're following me. And I really do, your dedication and time to the philosophy of the Lionhearted dentist. Thanks a lot for listening. I'll see you next week.